Hi everyone, we will talk about the vertical releasing incision and the areas in the oral cavity that should be avoided during placement. You have to know that there are 7 areas in oral cavity that should be avoided during placement of the vertical releasing incision. This is the first area. As you can see in this picture, this is the vertical releasing incision placed through the papilla. This is wrong, okay? Because as you can see in this picture, the vertical releasing incision transects the papilla. This will cause dehiscence and also periodontal defect. Now we will talk about the second area. The second area, avoid to place the vertical releasing incision at the facial aspect of the mid-crown, as you can see in this picture. The vertical releasing incision placed at the mid-crown. This also will cause dehiscence and also periodontal defect. So this is wrong. Avoid to place the vertical releasing incision at the facial aspect of the mid-crown. Now we will talk about the third area. The third area in oral cavity is the bone prominence. As you can see in this picture, the vertical releasing incision placed over a bony prominence. This bony prominence, as you can see, it is a position after extraction of the canine. Avoid placing the vertical incision here because this will cause tension on the flap, okay, and also will cause delay healing and dehiscence. So this is the third area in oral cavity which should be avoided. Now we will talk about the anatomical landmarks that should be avoided during placing the vertical releasing incision. Avoid placing the vertical releasing incision at the mental foramen region. As you can see, this is the mental foramen region. The position of mental foramen differ between individuals, but usually it is located between the lower 2 premolars. If the vertical releasing incision placed here, it will cause injury to the mental nerve. So avoid placing this incision here. Okay. The fourth area, this is the vertical releasing incision placed at the palate, and this is wrong also because this will cause bleeding and injury to the greater palatine artery, which comes posteriorly, and also will cause injury to the neurovascular bundle. So avoid placing the vertical releasing incision at the palate or through the palate region. These are anatomical limitations for the placing of vertical releasing incision. Also avoid placing the vertical releasing incision at the lingual side of the mandible, especially posteriorly, because this will cause injury to the lingual nerve and also will cause delay healing. Okay, so you should avoid placing this incision lingually. Now we will talk about the last area which should be avoided during placement of the vertical releasing incision. You should avoid placing vertical releasing incision at the bony defect area because this will lead to the collapse and delayed healing also. Thank you all for your listening.